How you doing, team? So in this video, we are going to talk a little bit about mobility. More than that, mobility that is specific to you and your lifestyle and your profession. Now, in this day and age, the majority of us spend an awful lot of time behind our desks. We have the internet to communicate, we have telephones to communicate. This means that we don't necessarily have to go and meet people face to face as often as maybe we once did, or the majority of jobs that were very, very active are now done by machines. This means that as a population, we are much, much more sedentary. This is causing a greater occurrence of back issues, health issues, and general mobility issues, which with a little bit of work can be easily fixed. Now, the problem is, if you are sitting most of your day, let's say you sleep at night, you get a solid 8 to 10 hours, you're fairly healthy, your sleep hygiene is very, very good. You wake up in the morning, you go shower, you go straight downstairs and you sit at your breakfast bar to eat breakfast or to drink your coffee. So the first thing you've done, you've got up and then you've sat down. You do what you need to do. You say goodbye to your partner, to your kids, and you jump in the car and you sit down. Maybe you jump in a taxi to the train station and you sit down. You sit down on a train onto your commute. You sit down on the way to work. You get to work, you say hello to everyone, you make your coffee, whatever, and then you go and sit at your desk for anywhere between 2 and 8 hours in that day, depending on how aware you are of needing to stay mobile. You then leave there. You might go to the gym for an hour, you jump back in your car or on the train, you sit down again, you go home, you have your dinner, you sit down at the table, you eat it, you then sit down on the sofa. So let's say we are awake for 16 hours a day. You've probably spent 12 to 14 of those hours sitting down. This is part and parcel of day-to-day life. Now, the problem with that is what it does is it shortens the front side of the body. So all of the muscles down what we call the anterior chain, the front half of your body, become shortened and dysfunctional. This ends up creating issues elsewhere throughout your body. The most common effect we see from sedentary lifestyle and sitting down too often or for too long and extended periods of time without mobilization is shortened hip flexors. So the muscles, superficial muscles on the surface, right at the front of your hip can tighten up and they start to cramp and things like that, and they can get sore if you do certain types of exercises. But more than that, and the one that commonly causes issues with your back, is your psoas complex. Now, your psoas complex, I'll step to the side and put up a graphic here. Your psoas complex is a group of muscles that actually originate on the lumbar spine, on the lower back. They come through the body and they attach to the front of the femur via the pelvis, kind of a cavity inside the pelvis. Now, the problem is, over time, as we are sitting down and we are in a flexed position at the hip, these start to tighten up very, very heavily. And obviously, because of that tension, they can't lift the feet towards the body because our feet need to be on the ground and we'd end up leaning forwards like so. So what they will do is pull the lower back, the origin, towards the insertion, okay? This can end up with excessive arches in the lower back. If not an excessive arch, it certainly usually ends up in a lot of tension in the lower back. Now, the common misconception is that this is a structural thing, it's a damage thing. More often than not, no, it is not. It is a tightness thing through the psoas complex and hip flexors, which is relatively easily managed if you do things right. Now, how do we do this? Number one is we stretch the psoas complex, and I'm going to show you a few stretches in this video to help you do that, both regressions and progressions, because it's important that when you stretch, you only stretch to your limit. We're also going to show you some glute activation techniques, because your body has a process called reciprocal inhibition, where it will not pull on the same joint in both directions at the same time. And what we're going to try to teach you how to do is use that principle to loosen the muscles off and allow less dysfunction around that hip. Because if we can loosen off the psoas complex, the hip flexor complex, open up the hips a little bit and allow them to move more freely, we're going to reduce the pressure on the back. Any kind of chronic pain, issues, or even restrictions training will start to go away. And if we can do that, your stress levels are going to drop massively. When your stress levels drop because of the lack of tension or potentially even chronic pain in your body, everything else is going to get better. Your sleep is going to get better. Your willingness to eat the right foods is going to get better. Your ability to train and do different types of training is going to get better, and everything improves. So we are going to show you those stretches, a few foam rolling techniques as well to help you out. It's important to remember that these things don't happen overnight. It's about repetition, repetition, repetition. It can take you 2 to 6 weeks to really feel a noticeable change in how your hips are feeling, or any muscle when you try to stretch it. It's not about stretching it like crazy on that day, okay, or on that session or that week. It's about stretching it just enough to feel the bind and then consistently doing that once or twice a day for 2, 3, 4, 5, 6 weeks, whatever it takes, and then maintaining that mobility. If you can put the effort in now, it's going to save you decades of dysfunction, pain, and stress down the line. So watch this video, try to practice some of the techniques I show you in it, and it will help you no end from both a physical point of view and a mental point of view, keep you injury-free, full of energy, and fully mobile for the rest of your life. Welcome back, ladies and gentlemen. So we are going to go through this little mobility routine that you should be doing as often as possible. I'm going to do it in real time right now, so you can do it along with me. If you want to do it along with me each time, just to keep your discipline a little bit and make sure you've got it right, then just skip to this part of the video every single session. Ideally once, twice a day after your workout, something like that, and it's really going to help you to move better, feel better, and remain injury-free for a long time. So first thing we're going to do a little bit of foam rolling. So this is essentially giving yourself a massage. Now, it can be painful, especially in the early days. You can pick up one of these if you don't already have one for 10 to 15 pounds, 10 to 15 euros off of Amazon. Really, really simple. It's definitely worth having in your house, even if you have nothing else, just to keep yourself moving, keep yourself injury-free. Now, first thing we're going to do is we're going to roll our quads, okay? The quads can tighten up, especially from home style workouts. So you have two options here. Option number one, place it just in front of your knees and then lean forwards onto it like so, okay? So all I'm doing here is I'm rolling my quads basically from the knee up towards the hip, nice and steady. I'm trying to keep my body as relaxed as I can as I do it. And what this is going to do is it's going to start to find tight spots in the muscle. When you find those tight spots, and they will be painful, okay, something you're going to have to deal with initially, just roll around on them to try and loosen them off a bit. Now, if you don't feel much there, what you can do is go to a single leg, okay? And what this allows us to do is it allows us to rotate in a little bit. So you can see now how my knee is facing the camera, and I can move around in that position as well, okay? Just rolling about. I'm going to spend about 30 seconds for the sake of this video on each bit. Now you will find myself, for instance, my VMO, the muscle on the inside of my knee, is very, very tight. I can feel a tight knot there. So I'm just going to spend a few seconds on it, just trying to roll through it and constantly breathing. Now it is going to hurt. Do not avoid those spots where it hurts. It's important that you spend a little bit of extra time on them to loosen them up. So I've got through that. So as you can see now, I'm rotating to try and get the entire leg and find all those adhesions, the tight muscle, the knots, and I'm going to try and work them out. So that one's fairly good. I'm going to do the same on the other side, so I'll switch around. We start on the inside of the knee, and we're just going to move around. I'll move into the center of the camera just a little bit there. So rolling up from the inside of the knee all the way to my hip, trying to rest as much weight on it as I can. You'd be amazed at how effective this is at just helping you move in a more smooth, stable way, ridding you of those little niggles. I'm going to move on to the front of my quad now a little bit, try and find any hot spots. This leg is a little bit healthier than the other one by the feels of things, which again is totally normal, so don't stress about that. Just moving around all the way up to the hip and all the way back down. Pretty healthy on that side. So that's our quad done. Now you can spend 30 seconds on that. You can spend a few minutes on it. The longer the better realistically, especially if you have a very large amount of tightness through there. Don't spend too long. You know, if you're spending 10, 15, 20 minutes doing this of a day, you can do, but there's a lot of toxins released when you start to break down these adhesions, and it could make you feel a little bit lightheaded, make you feel a little bit rubbish. So don't spend too long. Next thing we're going to do is the IT band, which is a strip of fascia down here. It gathers loads and loads of tension. If you run a lot, it's likely to cause you a lot of pain. So this one is extremely painful. The way we do it is we start with the roller just above our knee, as you can see there. I'm putting the weight on my elbow and on my foot, and I'm simply going to roll up and down along that band, rotating my body slightly, all the way between the knee and the hip bone. Okay, to release that tension, rotate backwards, rotate forwards. Now, this one, there are going to be places where it hurts like crazy. So if you're doing it with me, you don't have to continue moving, but if you find a hot spot, rest on it, move just a little bit, and breathe through it. Now, you're not expecting to make everything pain-free within a session, all the way down to the knee. Lovely. Not expecting to make everything pain-free within a session, but certainly within a couple of weeks, we want to try and reduce the amount of pain. So again, on the other side, just above the knee, and we're gonna move backwards and forwards. Side T-band. Any cyclists, runners, anything we do fairly high impact, or if you have knee problems of any kind, this is usually a great way to fix them. So it's worth spending that time. Try to relax, breathing on it right up to the hip bone, right up to the hip bone, and then down onto the knee. We rotate backwards a little bit to find areas of tension. We rotate forwards a little bit to get the outside of that quad. And when we've hit about 30 seconds, we move on. Again, remember, as you get better at this, you gain a better understanding. You don't have to do it with this video. You can spend a little bit more time on each muscle. Next thing we're really going to quickly do is try to release the glutes just a tiny bit. Now you have a few options here. You can either sit down, I'll go to a diagonal. You can sit down on the roller like so, with both legs, and just rotate backwards and forwards, ever so slightly to the side. Okay, so now I'm leaning off to my left. I've rotated my whole hip. So the roller is now attacking the outside upper edge of my glute here. Okay, I'm gonna spend about 30 seconds here, moving around, rotate fully, side to side, so we can find spots where that glute may be tight. Again, we're working just underneath the top of the pelvic bone. Those little dimples you find in your back, we're working somewhere around there, and then right down around the side, but above this bony process in your body. Once we've done that, I'm gonna go to the other side. So I'll move the mic ever so slightly, and you can see exactly the same thing. So I'm just starting, rolling basically between my lower back and the middle of my butt cheek, feeling the tension in the glutes, and then I'm gonna roll a little bit further to the side, supporting my weight on my elbow. Now I'm hitting what we call the glute med. So this is above the bony process on my leg, but below the spine of my pelvis. Okay, and here, this area especially, can create a lot of tension through the lower back, a lot of tension through the lower back. So by releasing this effectively daily, you're gonna reduce a lot of that tension that runs up through something called the thoracolumbar fascia. So it's kind of a band of fascia. Fascia is like a sheath that sits up your lower back. It's about 30 seconds there. Sits all the way up here, and it can feel like back pain. It's very rarely back pain. It's usually just pain in the glute or tightness, which is pulling on that fascia. If you suddenly get issues there, you roll that section of your glute exactly as I've just shown you. Once we do that, it's very, very easy to get rid of the back pain. So that's a real quick way, foam rolling a few key muscles. There are many, many more you can do, and you can do them for much longer, but a few key muscles to help keep your hips healthy. We've rolled the quads, both inner, outer, and center, which is going to release any tension on the knees, which is going to be very, very beneficial. We've done the IT band, which again is going to release any tension on the knees and help to keep our patella in line. We've also now done the glute med especially, which are the sections of the glutes that kind of sit at the upper side of your body, which can gain loads and loads of tension and cause some radiating back pain. Now we're going to move into some stretches. So we're going to start off very simply with a knee to chest stretch. So this one, lie down with me. You can put something under your hips to elevate your hips slightly, and you'll get a greater stretch on this. This is to stretch the psoas, as we mentioned in the introduction. So with one leg out straight, bring your other leg up and simply hold like so. Now we're going to hold this for about 30 seconds. Breathing as deeply as you can, trying to relax the hips. Some of you may find there's a stretch in your hamstring here. Some of you may find there's an impingement in the nerve, in the muscle here, your TFL. If that's the case, start by rolling your leg out and then pull it into that position, and you may find it overcomes that. We're breathing nice and deeply. We're stretching the hamstring, allowing a stretch on this side of the hip as well. We're going to hold for about 5 more seconds, and we go to the other side. Big deep breaths throughout. And then that leg down, and we bring the other one up. So again, as I say, you can put something underneath your hips, a rolled towel or something like that, which will allow you to lift the hips up and create a bigger stretch on this. So we come in again, and again, expect some asymmetry side to side. That's totally normal, very, very common. We usually have a favored foot, which will result in a stronger leg, stronger hip, and some element of dysfunction, which can cause a twist in the hips. Big, big deep breaths. As you get deeper into the stretch, try to pull it a little bit more, but never overreaching. Never going to a point where this is causing you pain or where your leg is shaking. We are simply trying to find a point of bind where the muscle is lengthened and we can breathe into the stretch. About another 5 seconds on this one. Pulling that stretch in nice and tight. 2, 1. Okay, so that is our knee to chest stretch. That's the first one. The next one we are going to do is a long lunge. So you'll recognize this from your warm-ups. We are going to come down onto one leg. We're going to take a big deep breath in and we are going to lean our body forwards. Now it's important on this one that you don't lean like that, because if you lean like that, you've shortened the muscle we're trying to stretch. So you keep your chest up and we're trying to really push our body forwards as far as we can whilst keeping that chest up, and it's going to open up the psoas complex. So again, we're holding for about 30 seconds. Now, for an extra stretch, you can place your opposite hand on that knee and just turn yourself into it, okay? Turn yourself into the leg that is at the front, and that, again, is just going to help to extend the muscle a little bit more. We're breathing through it. We're pushing long into that lunge. Long into that lunge. About another 5 seconds. And as you do, you may feel that it opens up and allows you to go that little bit further. So if you can, do. Okay, we come back. Just give that a little bit of a rest. The next one we're going to do is very, very similar. It's a short lunge. But what I want you to do is just find a mild point of stretch. And then at that position, squeeze your bum cheek on the back leg, okay? So we're short lunge, now we squeeze the bum cheek on the back leg. Even though we're not pushing as far, by engaging the butt cheek, we are manipulating something called reciprocal inhibition. So by firing up that back leg, or the butt cheek on the posterior chain of the body, it's going to start to help loosen off the front of the body from a neural standpoint. It's going to send different signals through the body. So we are in a shorter lunge, but this time we're squeezing the glute as hard as we can on that back leg, and it should be putting a greater stretch down the hip of your front leg. We're going to hold this for about another 10 seconds, and then we do long lunge on the other side. Remember your breathing. I'll do the talking, so you just concentrate on your breathing. In 3, 2, 1, other side. It's important with these stretches, we're going to the long lunge, that you're not trying to arch your back too much, because if you remember in the intro where that muscle connects, if you are arching your back, you're actually allowing the muscle to shorten again. So we need to try and keep our back as straight as possible without arching too much. Push into that long lunge, and we're trying to feel the stretch here. We don't want to feel loads of tension on our lower back. So breathing into it. Ideally, if you can do this 2 or 3 times a day, amazing, especially if you have an issue. If you don't, then once a day is enough to really start to help you out. But the more frequently you can do it, the better. Little and often. Big, big deep breaths, pushing forward into that movement as best you can. This is our long lunge, opening up the hips. You know, end of the day, beginning of the day, either or. It's a really, really nice way to start your day, mobilizing your body a little bit. 5 seconds left. 4, 3, 2, 1. We come up, just give yourself a little bit of a rest, let that hip shorten a second, and then we're going to go into our short lunge where we squeeze the glute on the back leg, okay? So short lunge, pushing forwards just a little bit, and then squeeze the glute on the back leg, which will put a bigger stretch on the superficial muscles, the surface muscles on the front here. So again, big, big deep breaths. As with the other ones, you can rotate if you want to get a bigger stretch, but don't allow that rotation to pull you forwards. We're still trying to keep our chest up, keeping that glute tight. Stretch only to your ability. Don't overreach, don't overstretch. In the same way that we do it in your workouts, it's important that you only stretch to your limit, otherwise you can cause damage. You'll see in a lot of sort of yoga classes, hot yoga classes, things like that, instructors are pushing down physically on participants. It's a very, very bad idea. It shouldn't be done by instructors, and you shouldn't do it to yourself, okay? Okay, 5 more seconds, keeping that glute tight on the back leg. Remember to keep it tight. 3, 2, 1, and back we come. Okay, give yourself a second. Let the tension drop out of those hips just a little bit. Again, remember, we're doing this in real time with me. but you can do this at your own pace and you can hold the stretches for much, much longer. I would never hold them for less than 30 seconds, but ideally a minute each would be perfect. The next thing we're going to do is a half frog. So what I want you to do is lie on the floor on your front like so. Now we're going to take the leg out to the side. Okay, get your knee out as far as you can, but we're also going to try and bring the foot out. You see where my foot is laying? And we're going to try to keep the foot flat, big toe side down. Now, in this position, you should be feeling a stretch inside the hip here, through the adductors. Big, big deep breaths. This one you may want to spend a little bit longer on, because for some of you, it's going to be slightly tighter than others. If possible, walk your torso away from that knee a little bit, and you'll feel the stretch get a little bit bigger. Now, if you are particularly tight in your psoas, the issue that we're talking about in your hips that may cause back problems, you'll really, really struggle with this. But please try to be patient, give it time, and you will get there. So this is a half frog. We're going to hold this one for a little bit longer because for everyone it's much more beneficial. And don't worry if for now you can't get your body into this position. If you can get it further than that, great. Take your time. It's about progression. It's about gradually learning how to stretch a little bit more every single time. So my leg is out to the side. My body, my upper body is pulled away from that bent knee a little bit, so I can really feel the stretch on the inside. And I'm focusing on trying to relax and trying to allow my hips to drop towards the mat. I'm not trying to lift it up like this. I'm allowing my hips to drop towards the mat. And there we go. There's a minute on that side. I'm going to flip round so you can see from the front. Same again. So we're lying flat out on our front. We take the leg out to the side, like so. We're lying the foot out and we're going to try to extend that leg just a little bit further out. And the reason it's called a half frog, if you imagine how a frog would lie down on its front or even on its back, similar kind of shape. You can do a full frog, which is both legs at the same time, but that's a progression. You need to be very, very flexible to be able to do that. So one leg is out behind, the other leg is out to the side. I'm trying to allow my pelvis, my hips to tip and fall into the mat on both sides evenly. Okay, you only work to where you're comfortable, and if you're particularly flexible, you can start to move your torso away from that knee to try and get a bigger stretch. It's also very, very important on all of these movements that you keep your breathing constant. Always keep your breathing constant. If you do, that's going to allow the muscles to relax way, way, way quicker. I'm going to hold this for about another 15 seconds. Breathing into it, really trying to press those hips into the floor, allowing your body to relax, allowing your hip to open up, keeping that back foot flat. 5, 4, 3, 2, 1, and then carefully come out of this one. Nice and gently using your upper body. Okay, next up we're going to go for a glute med stretch. So again, hopefully you're still with me here. You have options with this one. In the workouts, you've seen us sit on the edge of a sofa and do it. Because I'm on the floor, I will show you how to do it on the floor just in case you don't have anything with you. So what we're going to do, we're going to lie back like so. We're going to elevate one leg and we are going to place the other ankle on top of it, okay? In this position, we're going to put a little bit of stress on this knee. We're going to push this knee away slightly. By pushing it away, we are going to hopefully create a stretch on the glute of this side. If you can't feel that, then you bring your foot closer. Do you see that? So how I brought my other foot closer, which is elevating the heel a little bit more. And then I can push into that stretch, breathing deeply into the nose, out through the mouth to try and make sure I can feel it going. Now again, some of you may not be able to feel this immediately in the target muscle. This could be because you're so tight in other muscles, you can't get into that stretch. The key is not to give up, it's to give yourself time, it's to be consistent with it and do the right thing repeatedly and you will get the right result eventually. We're going to take about another 10 seconds here. If you can, give it an extra little push. Really find the stretch on the outside of that glute in 5, 4, 3, 2, 1, and up. And then we're going to go to the other side, exactly the same thing. Now, if you're anything like me, one side will be much more flexible than the other. Again, that's totally okay. So I've placed this ankle up on the knee. I've got that tension there, and now I'm gonna push gently on the foot that is elevated via the knee to find a stretch in the hip. Now, this is a really simple glute med stretch. There are more stretches we can do for the glutes that I will show you at a later date, but this initially, this along with the rolling of the glutes is gonna be one of your best friends to prevent yourself from getting back pain, or if you have tightened up particularly from a long day, maybe you're commuting backwards and forwards, this is a really, really nice way to get those hips freed up again and prevent back pain. Those of you with back pain already, it's important that you do this more regularly. For those of you who are fairly mobile, fairly healthy, and are not getting chronic back pain currently, it's about prevention rather than the cure. So still, you should be doing it ideally every day, at least every other day if you can. Okay, 5 more seconds. Give that knee an extra little push just to stretch the hip. 2, 1, and relax. Down, 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 down. Right, that is the stretching portion. Now what we're finally gonna do in order to try to help the psoas complex, those muscles through the hip, loosen off a little bit, we're gonna fire up the glutes just a little bit more. This is a really, really good way to practice getting your glutes working. It's a great thing to do before a workout if you have time to make sure we are using the right muscles at the right time. So finally, what we're gonna do, we're gonna line our front like so. Up to you how you do it. You can place your forehead on your hands on a towel, something like that. We're simply gonna lie there, point our toes, and what I want you to do, one leg at a time, we're gonna do 12 reps on the left leg and 12 reps on the right leg. You're just gonna squeeze your hips, squeeze your glute, and lift your leg off the floor, just a little bit. We're not trying to drive it up, we're not twisting our body like this. We are literally just squeezing our bum, lifting the foot off the floor, straight back down. Up, squeeze, pause, down. Up, squeeze, pause, down. 3, up, 4, up, squeeze, pause, 5, keeping that leg straight. 6, you don't have to lift your body miles off the floor, it's small movement. 7, flexing the glute as hard as you can. 8, up, 9, 3 more, squeeze up with me, down, squeeze up, bang, last one, there, and then we go straight to the other side. Notice how I'm not twisting my body, I'm not arching my back, I'm not lifting my chest, I'm just using my glute to lift this muscle up. 1, and down, up, pause. 2, just focus on clenching the belly of your glute. 3, your butt cheek, squeeze. 4, you can place your forehead on your hands. 5, which is going to help you to discipline not arching your back. 6, I'm hoping it's not messing with the sound too much when I do that, so I am going to keep my head up. 7, 5 more, up and squeeze, feel that burn in the glute. 4, up and squeeze. 3, up and squeeze, focus on the glute, not the lower back. Small movements, super disciplined, and there we go. So it's first of the glute activation. Now we're going to do exactly the same thing, only you're going to hold your knee at 90 degrees. So we don't lift with anything other than our glute. Squeeze up and down. There's 1. Up, down. See how small a movement it is? Really, really small. We're just lifting that knee off the tarmac. 4, 5, 6. Pause at the top. We're not swinging the hips around. 7, we're keeping everything perfectly controlled. Flexing the glute. 8, 9, with my count, don't rush, up and squeeze. 10, last 2, 11, up, and 12. Then straight to the other side. This is the last exercise of the day, so let's make sure we get it nailed. Foot flat on the back, up and squeeze, just flexing the butt cheek, pushing the knee off the mat an inch or 2, no further. Up and squeeze. 3, down, up and squeeze. 4, down, up and squeeze, clench that butt. 5, 6, and what this is doing is it's helping us to generate more neural drive. 7, more electrical signals to fire up the glute. 8, which over time, as we stretch the hip flexors. 9, is going to help the glutes take a little bit of dominance around that joint. 10, 2 more, which means our hip complex, the whole hip function works better. And done. So safely come up. Now what you should be feeling now is a little bit more freedom in the hips. The glutes should be firing a little bit more. Really, really simple. This has been done in real time with me, but of course you can do it at your own pace. You can spend more time or less time doing it, but I do advise at the very least you try to get it done every other day, especially if you have chronic back problems, because this will go some way to fixing them. Take it at your pace, don't overreach, don't overstretch, very, very important. But if you do this, you are consistent in this, you will be amazed at how much it changes your life, both physically and from a stress management point of view, because you may not even know that you have chronic pain. But once you realize that you no longer have any pain or niggles or issues and how well you move, everything is going to change. You're going to spend more time playing with your kids. You're going to have more energy because you're not drained. As weird as it sounds, when you're trying to walk around with tight hips, you're having to put more effort in. It's like dragging concrete blocks around with you. When your hips start to move freely, when your body starts to move freely, you feel better. So try to get this done if you can. Amazing every day. Awesome if you have that time and that kind of commitment. Every other day should be enough for most. The better you can mobilize your hips, the healthier you're going to feel. Good luck.